About 1 million people in the U.S. have hernia surgery every year with a very high success rate of better than 90%. Some of those surgeries will be considered complex hernia surgeries, and they may involve rebuilding the entire abdominal wall. Joining us now to discuss is Dr. Hany Takla from the Orlando Health Complex Hernia Center. Thanks so much for being here with us today.
Thank you for having me.
All right, so first of all, please explain to us what a hernia is and how we know if we have one.
So what a hernia is, I usually explain it to patients the same way. So if you imagine the room that you're sitting in, and if there's a hole in the ceiling of that room, and then the chairs and everything inside the room are the contents of that room. So it's similar to your abdominal cavity. So a hernia is a hole in the abdominal wall or in the muscles of the abdominal wall. And then the fat or small intestine or large intestine that's inside the abdominal cavity bulges out through that hole. So the chairs or anything inside the room bulging out through that hole in the ceiling. And because that hole is a rigid ring of muscles, so it squeezes the blood supply to that area, so it causes pain sometimes, and occasionally these hernias can get stuck.
So beyond being able to feel something, what are the other screening methods that you use to determine if someone has a hernia?
Yeah, so a physical examination by your physician is the best tool to find out whether you have a hernia or not, but there are some other modalities like ultrasounds or CAT scans.
So a simple hernia is something that is considered small and can be dealt with in a certain way. A complex hernia is something completely different. Can you explain that?
Correct, yeah. So what we mean by complex hernia is a hernia that's not very straightforward to take care of or repair. So hernias that have been repaired before and came back, something called a recurrence. So if someone had a hernia before, or if it's a very large hernia. So we see people sometimes that have a hernia that's very, very large, like 16, 17 centimeter hernia. So that requires a lot of other methods or different methods that are complicated to repair, and that's why we call it a complex hernia. The theory behind repairing hernias is to try to restore the anatomy as close to normal as possible. I mean, obviously, we're not going to be able to recreate what was created before. So what we try to do is to try to simulate the normal anatomy. So we try to suture different muscles together that were supposed to be together. We try to reinforce that repair with either a mesh that's absorbable or a permanent mesh in order to give it more reinforcement to minimize the risk of the hernia coming back in the future.
How do you personally feel when you have a patient who's been suffering with a complex hernia and you're able to help them?
It is very satisfying, and that's actually a big part of why I love what I'm doing, because I feel I'm able to make an impact on the patient's life. So if someone comes to me and they have a hernia, usually it affects their activity level, being able to have fun with their family, going out or exercising, etc. That's the main complaints I hear from my patients, right? So when I'm able to address that and then get them back to normal activity, being able to do the things that they love doing, that I'm very satisfied and very happy.
And if you'd like more information, you can visit orlandohealth.com/complexhernia.